Descartes, I think therefore I am, same guy, he wrote a lot about pain. And he drew this diagram in 17th century. And what he said, well, I like to show this. I bring it up to modern times. Okay. So the fire, what Descartes said in French, of course, the fire burns foot B, and they didn't know about nerves, they didn't know about synapses, they didn't know about any of that. But he said somehow the information travels up the spinal cord, and it gets to the brain, and you get pain. It's very simple. Now, the sad part is I teach medical students, and you look up in any textbook, in the modern neuroanatomy textbooks, don't look all that different. All right, got to add the fire. Okay. Basically, doesn't this look like Descartes? In this case, we've thrown in nerves and we've thrown in synapses or connections between nerves, and we have nerve fibers in the arm, say, that get burnt. The skin gets burnt, the information goes into the spinal cord, you have a connection, the information goes up to the brain, and somehow you get pain. The problem is this is all about acute pain. This is how you get acute pain. You burn yourself, you stick a needle in, somebody pinches you, and this works. Of course, as I told you, it's not important. If indeed it were important, how would we treat this problem? Guaranteed to work 100% of the time. How? Well, take his foot away from the fire. That's one way to do it. But let's assume that his foot is paralyzed and he can't move it away. I want to treat this person who has chronic pain, and this is the mechanism. It's just the pathway that goes through. How do you treat it? Cut it. Cut it. Right? Do you agree? The brain's not going to get any information if I cut it. The analogy I like to draw, which doesn't work with the students because I know what the hell I'm talking about, is a telephone. Right? Here's a telephone, and it has a wire. And if you cut the wire, the telephone doesn't work. Now, I tell the medical students, and they look at you with this blank face. They take out their cell phone, and I don't know what you're talking about because there's no wires. But anyway, I think we understand the wire is essential for communication. If indeed cutting doesn't work, what it means is there is no pain pathway. All right? Nevertheless, neurosurgeons continue to cut. They try because patients who have severe pain and aren't responding to drugs will seek out somebody who will offer something new. And this is an interesting diagram of the pathway that takes information from, in this case, the foot up to the brain, and it illustrates some of the procedures in red that continue to be done. Whether cutting a nerve in the leg to block pain, in the spinal cord, if it doesn't work low, do it a little higher. Take out areas of the brain, literally chunks of cortex, or even do a variation on this, a frontal lobotomy. We all remember the 1950s frontal lobotomies. Well, I told you that pain has an emotional component to it. Well, somebody reasoned that I can eliminate the emotional the ability of this patient to experience emotions. It works. Sort of destroy their personality at the same time, but this is done, and in some places it continues to be done. If indeed there were a pain pathway, you wouldn't need to cut it all. You just got to cut down here, it would work. It doesn't. Conclusion, there's no pain pathway. So what we need to understand is, where does everything fall apart? Where does the idea of a specific pain pathway actually break down? And the answer is it breaks down real early, right out in your arm, in your leg, and I'll try to explain what's going on. So let's talk a little bit about the anatomy and biology of pain. So what we're looking at here, I take your spinal cord, which is a big long tube, and I'm going to cut it like this and look at it, and this is what it looks like. And here's a foot, and here's a nerve that's in your foot. The nerve has a cell body, but it has a branch that goes out to the foot, and then it goes into the spinal cord where it makes a connection with a bunch of other nerves, and we don't have to worry about the details. That information goes out and then goes up to the brain. Seems so simple. This is real anatomy. It's there. But if we look at a peripheral nerve, all right, if we look at a peripheral nerve, we find that they're all different size nerve fibers. They're not all the same. And if we look at them, this is one example of what a peripheral nerve looks like, all right? What you have are large fibers, and you got little ones. The large ones have what we call myelin. They conduct very quickly. Those are the ones, the largest ones respond to light touch when you bend your fingers, to hair bending. They respond to innocuous, non-painful stimuli. The small fibers, these guys and these guys, respond to painful type stimuli. Seems so simple, all right? But